very good evening to you all. Myself, Dr. Sumedha Gupta, and on
Yeah,
behalf
hi,
of
hello.
Voice of Care, I would like to welcome all the viewers who have joined us. So today, we are here for an insightful session on the topic Heroes Fight for Health. Join the Prostate Cancer Awareness. And I would like to mention that this initiative is supported by Zydus Life. So, as of the latest data, prostate cancer is one of the most common cancers among men in India. According to WHO, prostate cancer accounts for approximately 11.6% of all the new cancers cases in Indian men, reflecting a significant increase in incidence over recent years. This estimated number of new cases is around 60,000 annually, with a notable rise in diagnosis, which is actually due to improved awareness and the screening practices. However, despite advancements in detection, the mortality rate remains a concern, emphasizing the need for enhanced care, public health strategies, and early intervention measures. And in the light of these stats and facts in this session, we are going to discuss about the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion, first, I would like you all to welcoming in our experts who are going to provide us with insightful information on understanding about the prostate cancer care and its awareness. So I would like to welcome Dr. Anshuman Agarwal, Senior Consultant Urology and Robotic Surgery in the Prastha Apollo Hospital, Sarita Vihar, New Delhi. Good evening, Doctor. Welcome to the panel discussion.
Good evening. Good evening, and thank you for having me.
Next, I would like to welcome Dr. Sandeep Batra, Senior Director, Cancer Care Oncology, Max Super Speciality Hospital. Welcome,
Hi, good
Doctor.
evening.
Welcome to the discussion.
Yeah, thank you, and good evening, everyone. And thanks, Sumedha and Zydus for this opportunity. Let's continue the discussions.
Next, I would like to welcome Dr. Nagender Sharma, Principal Consultant, Med Onco, Max Saket, New Delhi. Welcome to the discussion, Doctor. Good evening.
Hello, good evening to everyone, and thank you, Zydus, for giving me the opportunity to be a part of this very large scientific feast. Thank you.
Next, I would like to welcome Dr. Gogi Ramana Murthy, Senior Consultant, Medical Oncology, Fortis, Gurgaon. Good evening, Doctor. Welcome to the discussion.
Hello, good evening, everyone, and I'm looking forward to have a good discussion with fellow panelists.
Great. So let's delve into the discussion. So first, I would like to ask Dr. Anshuman, can you please define what constitutes a holistic approach to prostate cancer care and how does this differ from conventional treatment methodologies?
So, a holistic approach, this can have several connotations, So, a holistic approach to any cancer could be, a coordinated approach by the entire team of the surgical oncologist or the uro-oncologist in this case, or medical oncologists, radiation oncologists, the nutritional experts, and rehabilitation. Because these surgeries or not so much the radiation, they lead to a lot of side effects in this whenever done in this area. So you need a battery of people to uh, help the patient to tide over the crisis. Plus, whatever surgery you do, it has got several implications on the urinary control, on the sexuality, and all prostate cancer treatment, whether it is localized prostate cancer or advanced prostate cancer. So this has a significant psychological impact also on the patient's life, because it involves the genitals, and it involves the urinary control mechanism, sexual function. So all those things get affected. So a holistic approach would be, when the entire team of medical, surgical, radiation oncologists gets together and does the treatment for the patient, and also involvement of the rehabilitation, like physiotherapy or dietary consultations or psychological support. So all of this would constitute as a holistic approach, for a particular patient.
Thank you, Dr. Anshuman, for these insights. And I think multidisciplinary approach is really important in treating any of the disease, any of the cancers. Moving ahead to Dr. Nagender, in what ways can integrating physical, emotional, and psychological support enhance overall patient outcome in management of prostate cancer?
Right. So, as we know that getting a cancer diagnosis and going through its treatment, it's not only devastating for the patient, it's actually devastating for the entire family. The challenges which this patient faces, they are not only physical, they are emotional, they are psychological, they are spiritual, and above all, they are financial. So we have to make sure that all these patients who are getting a cancer diagnosis, they require hand holding. In a hospital where we are working, we are having a qualified onco counselors, psycho-oncologists who are always involved upfront only when the diagnosis is established. We have to make sure that they stay positive, they stay optimistic. Hope also is oncology, like hope also is a treatment in oncology, right? So ultimate aim is that we have to keep these patients as good as possible for as long as possible with the limitation of science, and that can happen if we correctly sequence the treatment modalities. Majority of these patients of prostate cancer, by and large, requires multi-modality treatment approach. So it is not only the drug or the treatment modality which conquers cancer, it is actually the patient's will to fight against the disease, the emotional well-being, and the correct sequencing of treatment modalities which ultimately conquers cancer.
Very rightly said, Dr. Nagender. Thanks for the insights. Moving ahead to Dr. Sandeep, I would like to ask what specific physical therapies or interventions have shown efficacy in complementing standard prostate cancer treatment?
So standard prostate cancer treatment involves surgery, that's the local treatment, radiation, that's again the local treatment, and systemic treatment in the form of hormone therapies and chemotherapies. Obviously, you will have the short-term and long-term side effects related to these local modalities or the systemic modalities. So, although medicines do heal up the cancers, but the side effects or the singeing of the rest of the body because of the side effects, they need to be taken care of with the alternative things. And physical activities, especially the exercises, they complement the treatment by improving the outcomes. Outcomes not only in the form of the better treatment outcome, but also the quality of life as well. Now, since surgery and the radiation leads to decreased pelvic floor muscle strength, there are chances of incontinence, which usually improves with time, but the addition of routine exercises added with the good nutrition improves and leads to early recovery. So, specifically, the pelvic floor muscle training and the exercises are the most useful modalities which the prostate cancer patient should be made aware of, and their rehabilitation should start even before the treatment is done. So treatment planning should involve the pre-rehabilitation in the form of sensitizing about the side effects that they can have, which are normal, which are expected side effects, because the treatment comes as a combo, effects as well as side effects. Now, training a patients to go for pelvic muscle floor training exercises in the form of Kegel exercises, besides that, standard walking, swimming, jogging, etc., as the conditions permit, physical health conditions, they should also be promoted in their total treatment modality plan. And as I said, this treatment also has the systemic side effects. So since you are removing in most of the patients the testosterone, which is the main male hormone right from the adolescence till the old age, even beyond that, now you have to complement or the effects that testosterone makes, that is in the form of a good bone health, toned muscles, and a good cardiovascular health. So, since prostate cancer treatment doesn't allow the supplementation of the testosterone, even if it is for the erectile dysfunction, you have to counter these side effects by incorporating more of the vitamin D intake, more of the sunlight exposure, and also something like aerobic exercises to improve the cardiovascular outcomes, cardiovascular health, so as to decrease the side effects which are because of the testosterone withdrawal. So, rehabilitation also should include the patient counseling, telling them about these side effects which are going to happen, and asking them and requesting them to be open to discuss these things, because many times discussing about the sexual function, discussing about the incontinence is a social taboo, or so people, most of the patients do not come, they open about it. And if they have got the education and the training for them beforehand, they will always come up to know, to tell you that these are the side effects I'm experiencing, and then you ask them to go for these supplementing therapies which can improve their overall health, leading to the improved outcomes.
Thank you for the insights, Dr. Sandeep. Moving ahead towards the discussion, Dr. Gogi, in your view, how do emotional and psychological support services contribute to the comprehensive well being of a prostate cancer patient throughout their treatment journey?
Yeah. So basically, I think, as already said by the fellow panelists, that prostate cancer is one of the leading causes of morbidity, I would say, or in among the males, it's one of the commonest by far, the second most commonest cancer in males. And we see this paradox, those cancers which have a long term outcomes, especially like prostate cancer. It has a long term outcome of, even in metastatic stage 4 cancers, they do live for longer years, like 7 8 years or 10 years also. So we have this paradox where, patients with long term disease, it's like a chronic disease. You see patients of chronic kidney disease or CLD, chronic liver disease, which have outcomes which are far less than metastatic prostate cancer. The quality of life issues also much differ in CKD patients. They have to go on a dialysis, all that stuff. So I think those with long term chronic disease, and I consider prostate cancer as a chronic disease, not as a malignancy. So I think these patients do require psychological support because they deal with this problem for a long time, for a longer time in their lifetime, I would say. So obviously they do require, larger support group, a long-term psychotherapist counseling, as well as an emotional support, family support, financial support, and because they're dealing with these cancers in a longer time and a longer time frame, they would require much more social support as well as the understanding. So I think patient education about their long term disease is the key in this, because obviously some cancers like pancreatic cancer or a gallbladder cancer, they don't live longer, not more than a year or two in most metastatic cases. So prostate cancer, in that way, I would consider as a patients who would have your visits in a longer run. So obviously the emotional as well as the psychological support group becomes key part, or rather a important part, I would say, in these prostate cancers.
Thank you, Dr. Gogi, for these insights. Moving ahead with the discussion to Dr. Anshuman, can you please tell us how can policy changes improve access to holistic prostate cancer care that involve the multidisciplinary approach and the overall treatment for the patients?
So this policy changes you are intending at the level of the healthcare administrators or the healthcare providers, or the government policies. What policies do you are you implying?
We can involve all of them, like the government policies as well, the providing deliverable
So,
policies as well.
so the government, yes, so that is the major, that is the healthcare system of a nation or healthcare system of the country. I mean, to have an, dedicated cancer centers which cater to people in a multidisciplinary, holistic way. And, as everybody has mentioned that, it is a cancer where patients are living for longer now, and more so with newer medications, newer treatment protocols. So there is a need, an emerging need for psychosocial well-being, their assessment even before you start a treatment. So you start kind of, so these policy decision is not something that we as doctors do. The policy comes from the government. The healthcare system is running in a way, and to have dedicated cancer centers which are run by the government, because prostate cancer treatment is a very, very expensive one. If one gets away with surgery or radiation, then it is the cheapest option. But once patients land up with chemotherapy and immunotherapy and what not, then the expenses are mounting. So the policy changes from the government side can be making all these newer drugs available in a mass market way, so that the costs are minimized, getting generics. But then there are license and patent issues. It's not a simple thing to do. And making dedicated cancer centers which have got all sorts of doctors to have a holistic approach towards treatment of prostate cancer. And from the point of view of an administrator, again, all these things would apply, and they have to percolate in a fashion, in a particular manner, right from the top to the bottom, so that you can have policy decisions wherein you can help these patients in the long run.
Thank you, Dr. Anshuman, for your views onto that. Moving ahead towards the discussion, Dr. Sandeep, I would request you to please tell us what is the role of patient education in the prostate cancer care approach and how it can be optimized for the patient benefits from their end.
So basically, educating the patients is like empowering themselves to take their own decisions. Gone are the days when There was a parental approach by the doctors for all their patients, where one size was fitting all. Nowadays, with the advent of the more information on the social networks as well as the platform like Google, people are more aware, they are more educated. However, they don't have the clear direction, the scientific thinking, because that needs a lot of training. Now, educating the patient about the educational resources which are available to help them make the decisions, because oncology is something where most of the times there are gray zones. There are not well defined white and the black patterns, that white is right and black is not right. The gray zones where one has to take a calculated risk whether to opt for that treatment or not. Now, unless until the patients are informed about the choices, which they obviously will try to weigh the differences between them after going through different choices, if they are scientifically told about them. However, it is not possible in a single session or maybe 2 or 3 sessions for all queries of the patients to be answered, and then you can direct them to the proper educational resources specifically meant for the patient to know about their disease, to know about their treatment, so that they know what is the path they are going to travel, and the life and the journey becomes much easier when you know the path that you are going to travel with, and what are the risks involved in that path, so that you can prepare beforehand for that. So unless until you empower the patients, they will always be in the dark. And obviously, if the outcome is not at par with their expectations, which usually happens sometimes, their confidence in the not only the doctor but the medical system that shakes up. That probably I am not on the right treatment, and then these people unfortunately direct themselves to the non-scientific or alternative treatments, which may be good in healthy people, but may not be proper in the disease like cancers to give them the advantage for the long-term control. So, besides telling them about the educational platforms, getting them in touch with the patients who have gone through the same treatment, like peer groups, patient education groups, because when we are on this side of the table, whatever we say, that is more of the science, and even though we try to add empathy to that, emotions to that, the patients, they are more receptive to the information that is given by the people who have been gone through that journey. So like it's a sailor who sails through the sea, and if the another sailor seeks their guidance, they are more confident in sailing the sea. However, people who get only directions in the form of a Google way of finding it, that you go this way, that way, left, right, center, they may be lost. So and enrolling them or asking them to enroll in the patient support groups is also part of their education, to improve their understanding of the disease, so that the problems that other have faced, they are aware of that, and they take it in their stride, that these are the treatment related adverse events, and at one point of time they may be faced, but later on they will subside. So basically, education and availability of education to the patient in a simpler terms is going to make their outcome better, and that's the way forward.
Thank you, Dr. Batra. I think you explained it very wonderfully, and these insights are really helpful. Moving ahead to Dr. Nagender, I would like you to please tell us: are there any recent research findings that highlight the benefit of integrating physical and psychological therapy in the care of prostate cancer patients?
Absolutely right. There are multiple studies, there are multiple trials also which are done in which the not only the physical, they have taken the parameters like psychological health of the patient also. But ultimately, whatever treatment modalities we are offering, ultimate aim is that we want our patient to live longer and live better, and that can happen if we integrate both the physical and the emotional component also. So emotional, like what is the patient understanding about the disease, what they want in their life. Sometimes we are dealing with the irreversible stage, that is stage 4. In that case, we know that no matter whatever we do, the ultimate aim is that the treatment modalities are going to be non-curative, and we have to treat the patient with the palliative intent. But even then, we have to make sure that patient should be able to eat properly, patient should be able to sleep properly, patient should be able to pass motion and urine properly, and patient should be pain-free in whatever limited science lifespan patient have got, right? So there are studies which are done in which we have taken into consideration that not only the drugs are approved by the median PFS, the overall survival, quality of life also is taken into consideration, that health-related quality of life parameters are taken into consideration, and then if the trial is positive, then only it will come into the practice, and we all are using those drugs wonderfully.
Thank you, Dr. Nagin, for these insights, and it's really helpful. Moving ahead to Dr. Ramna, how can healthcare providers better identify and address the psychological impact associated with the prostate cancer diagnosis?
So, so as you're pointing out, identification becomes an important issue, I would say, because most of the times, if you see, doctors are quite busy in their OPD, so majorly dealing with surgical aspect or a radiation aspect, or the chemotherapy aspect, explaining the side effects or the cost issues and logistics. At times, you miss out on the emotional as well as the psychological effects of the diagnosis itself and the treatment effects, and also the job loss, or maybe the caregiver lack of caregiver support, or a family support, logistics, financial. So all these, I think, becomes takes a backseat in the discussion points in the OPD rooms. So having a psycho-oncologist or a psychotherapist along with you in the team also helps in identification, because most of the times you tend to miss out, or rather may not have time, in fact, to deal with these issues, or rather identification. So I feel having a team approach, where there is a obviously the multidisciplinary teams with surgery, radiation, palliative medicine, and also having a separate psychotherapist does help you in identification and subsequent referrals. So I think the key point is to have a psycho-oncologist, because even many of the oncologists or the surgeons, they are quite busy with their own aspect of the treatment. I think that is a key point, to have a psycho-oncologist along with your team.
Thank you, Dr. Hogi, for these insights. Moving ahead with the discussion to Dr. Anshuman. So, according to you, what role does nutrition play in managing prostate cancer? And are there any specific dietary guidelines you want to recommend to the patients who are diagnosed with the prostate cancer recently or are at the verge of this disease?
See, there are a whole lot of nutritional things available in the market. Now, this is another very big gray area because you really have nothing which is proven beyond doubt that this is going to help. Now, there is a wide basket of products available in the name of nutraceuticals, and if you can see that a lot of these pharmaceutical companies or generic, a lot of these non-pharmaceutical companies also, some even cosmetic industry and whatnot, food industry, they are making everything in the name of nutraceuticals, wherein there is no proven role of any particular product that may harm you or that may not harm you, but they are quite heavy on the pockets. So whatever nutritional supplements that I have come across that are marketed in the name of prostate cancer would include, green tea consumption, consumption of lycopene products, and all these things are very easily available in the normal daily diet that you take. So I would say that reduction of weight, reduction of intake of cholesterol rich foods or foods with polyunsaturated fatty acids, and too much of sugary foods, all these things have had some benefit in preventing cancer overall. So there is nothing that says that that this is going to prevent prostate cancer overall. So I think all that we can say is a healthy diet, and obesity has been linked to several cancers. Supplementation of vitamin D, which reduces inflammation and enhances immunity and skeletal muscle and bone health. Because eventually, when you are treating prostate cancer, number one, you're trying to prevent it. There is no concrete role of any diet. Number two, you're trying to treat one, and then there is a role of diet, which is very important, that to maintain your bone health and to maintain the level of antioxidants in the blood to reduce the inflammatory products that we consume on a daily basis. So I would summarize by saying that a normal healthy vegetarian diet is something that is required for everybody, and a fiber rich diet and rich in antioxidants, which are provided to us with a lot of vegetables and green tea consumption. So all of these will have several ingredients that will help us fight inflammation and cancer overall, not just prostate cancer.
Thank you, Dr. Anshuman, for these insights on dietary recommendations. Moving ahead with the discussion, I would like to ask Dr. Sandeep. So, we talked about the dietary part. So, according to you, what role do the lifestyle modifications, such as exercises or maybe doing the holistic management of prostate cancer, how these can be effectively incorporated by the patient during the whole treatment journey?
So about the dietary modifications, Dr. Anshuman sir has already dwelled upon that. I will add one sentence to that, that focus more on the diet which is grown on the plants rather than on the diets which are made in the industrial plants. So, so that clearly sums up that more of the fibers, more of the green teas with the antioxidants, more of the tomatoes which has more lycopene content, rather than going for the supplements which are made by in the garb of the nutraceuticals by the companies to promote, but without really replacing the benefit that's there from the natural thing. Now, coming to the exercises, it's now it's a firm belief that sedentary lifestyle is now the next smoking. That is even worse than the smoking. uh, at least about 150 minutes, that is 2.5 hours of regular exercise is the minimum basic required for a healthy individual to remain healthy in a week's time. Now, that can be done in the multiple ways. Now, although the most people, I would say, no one would be deficient of a space to walk, but that walk should not be a jaywalking. That's like a something at a moderately paced walk at 6 to 8 kilometers per hour. Something while walking, you are able to talk, but you are able to talk when you are getting breathless while you are talking. So that's the pace of walk that you are to do. That's something called an exercise. It's not something like chit chatting and walking at a pace of 4 to 5 kilometers per hour. That's not considered as an exercise. Now, if someone loves cycling, someone loves swimming, they are the complete wholesome exercises without stressing your joints. Now, prostate cancer is mostly a disease of the old age. So most of the times you will have osteoarthritis, knee problems, making it difficult for them to walk at this pace. So these cycling as well as the swimming are something you can enjoy without stressing your joints. So joint health is maintained. Now, having said that, any sort of aerobic exercise, whether it is hard on the knees or not, it depends upon the person's build. That should be done at least a minimum of 2.5 hours for a week. But it's not that you do it on one day, 2.5 hours, and the remaining 6 days, nothing. So you have to evenly space it. Someday you can do 60 minutes, someday you can do 30 minutes, but at least 5 out of 7 days. It's like 5 work days in 7 total days of the week. Similarly, at least 5 days out of the 7 days, you should have a target of 150 minutes. Although I'm not a very big fan of these smartwatches, but I think in the old age, when you cannot keep track of your activities, smartwatches like something from the big Androids or the Mac platforms, Apple watches, etc. They can give you the reminders that you need to get up, you have to walk, you have done this much activities, you have burned this much calories is going to be at. So you need to help technology make you healthy rather than using the technology to make you more sedentary. uh, Besides this, I would say if someone, it's more of the I have already said that patients should be involved in the support groups. Now, as a support group, activities, combined group activities can be done in which the patients enjoy most. And when they see other doing something, they feel that they are missing that particular part and then start doing it. And this is the only way they can help themselves and help us help them so as to make them healthier. So to summarize, about 2.5 hours of a brisk activity in the form of walking or swimming or cycling is the minimum basic which is required, irrespective of the age, to keep a patient who has been treated with cancer to make them healthy. It also boosts up their immunity. The last remaining cancer cell is in the body is not killed by either the chemotherapy or the radiation therapy or the surgery. It's the body immune system which kills the last remaining cells, and it also helps killing those cells which are going to arise in future. So exercise builds up immune system to improve your outcomes. Until date, no person who has exercised, I would make a star over there, that over enthusiastically exercise. Exercise has killed no one, but the lack of exercise killed a number of healthy persons as well in the past.
Thank you,
Over to
Dr.
you, sir.
Sandeep. Thank you, Dr. Sandeep, for these insights. And I think these recommendations are really useful for the patients and the seekers out there. Moving ahead with the discussion to Dr. Nagend, could you please provide us with some successful stories of the patient where the integrative care for the prostate cancer patient that combines the multiple aspects of support? Dr. Nagend, you are on mute. I would
Right.
request you to. Yeah.
Yes, I'm audible, I guess, right? So, as an integrated model of healthcare, as far as prostate cancer is concerned or prostate health is concerned, we have to look into the lifestyle changes and we have to look into the complementary intervention. What I'm trying to convey is like diet. Most important thing is diet. A nutrient-rich diet with lots of fruits, vegetables can help to reduce the inflammation, can reduce the oxidative stress, which is very common cause of the prostate cancer progression, which can contribute to the prostate condition, not only prostate cancer per se, prostatitis and other conditions also. Some foods that are particularly beneficial, that are tomatoes, which are rich in lycopene, the fatty fish like salmon fish, which contains omega-3 fatty acids, is of paramount importance. Second thing is supplements. Supplements in the form, like we can have supplements in the form of vitamin D3, we can have omega-3 fatty acids, we have other preparation also, calcium supplementation also, which is very, very important. Third point is the physical activity, which Dr. Sandeep Batra alluded to, that physical activity can be very, very helpful to this patient, which strengthens the bones, improve the body habitus, and enhances the overall well-being of a person. Fourth, most important thing is yoga. Yoga also combines physical activity and the mind-body component is there. That also, for a period of time, reduce the inflammation and oxidative stress, because of which this patient feel much, much better. And mind-body intervention form of mindfulness, that we can have meditation, pranayam, all this, if we integrate as far as the holistic approach, by and large, this will help our patients. So this is what I'm recommending. Not only it's not the drug which conquers cancer ultimately, it's the combination, the holistic approach, the preventive strategies, all this combined together, and the positive and the optimistic will of the patient to fight against the disease, which ultimately conquers cancers.
Thank you, Dr. Nagin, for these recommendations and these insights. I think it's really useful for the patient out there. Moving ahead with the discussion to Dr. Ramana, what are the current gaps in the insurance coverage or maybe support for the holistic prostate cancer treatments, and how can advocacy of efforts help to address such gaps?
The insurance, right?
Yeah.
Okay. So like if you see, by and large, if you know the patients with insurance cover, I mean, maybe close to more than 90%, 95% would like to take treatment. In general, patients with support, either a government support or other PSU support or private insurance, they most likely more than 95% would like to take treatment at a good center. Whereas in patients without insurance cover, if you see, I think more than half of the patients would lose out on treatment in general. Maybe if you see in Delhi NCR, where people are coming from the high income groups mostly, so the access rates are more high. But if you go in general to other parts of India, I think the accessibility becomes a major issue, and without insurance cover or support, I think the access itself becomes less than 50%, I would say, the access to the cancer care. So that way, I think increasing the insurance becomes a very key part of the cancer care, be it prostate or any other cancer for that matter. And also, I think it's not a gap, I would say, but it is an empty space. Insurance is an empty space. There's no major players in so I think we need more of a either an NGOs or a private sponsors or public private support groups to come into the space and increase the scope of insurance cover. So that way, I think it's not that there are gaps in insurance, but I think it's all empty, especially in India, in various parts, I would say. And if you speak to, I mean, if you ask me the insurance gaps as such, then obviously we have problems with the support care. Many insurance companies would deny the support care. That's a routine situation for us in clinics, or deny the certain hormone therapies, especially you're talking about prostate cancer. So they may not admit make eligible hormone therapies or some form of therapies. So I think cancer does not come in one scheme, like just like some chemotherapy or some surgery. Most insurance companies, I would say, would cover these part, but they leave out the other aspects of the treatment, like supportive group or an antibiotics or an infection, or like psychological impact and all that. And in that way, I think there has to be discussion among the insurance providers and the healthcare providers to come up with the schemes where they could be, all these aspects of the treatment should be included, be it psychological impact or a palliative care for that matter. They should be included in the insurance so that there is a wider coverage, and thereby increasing the access itself. So I believe lack of access itself is a big problem. So then I think insurance is comes very very late.
Thank you, Dr. Gogi, for these insights. Moving ahead to Dr. Anshuman with the discussion. So, can you please provide us, like, what are the some common misconceptions or maybe misunderstandings or maybe gaps about the prostate cancer that you frequently encounter while dealing with the patients, and how can we address these misunderstandings very effectively? Dr. Anshuman, you are on mute. We cannot hear you.
Yeah.
Yeah.
So coming to the misunderstandings about the prostate cancer and its treatment, so it stems from the fact that people try to find out from their peers and compare themselves with other people as to what is going on in their lives. No two patients would be alike, and there would be certain determining factors in each one of them that will differentiate the treatment, for the same disease, between 10 people. So 10 different prostate cancer patients could be treated in a different manner. Now we are in a very vast and a diverse country where there are different methods of treatment, different schools of treatment, like Ayurveda, like homeopathy, like naturopathy. So everybody, in today's times, they try to treat cancer, and these are patients who are very very psychologically debilitated. The moment you have a diagnosis of cancer, and the psychology of a patient is hit hard. What to talk of the patient, all his family members, people around them, they start thinking now what is going to be the future, and how they will cope up with the expenses of the treatment, where they should go, what is the best therapy. Even four doctors sitting in a panel may not come to the same conclusion. So from there, things like misunderstandings, they stem, because there are people then who will lure them towards different forms of treatment, and which are at best not proven to be effective. So many people I see in my practice have already visited these people who claim to treat cancer, by different natural processes and different therapies which are not standard of care. So there is number one misconception at the level, that cancer can be treated by several other ways. There will be some anecdotal experience where a prostate cancer patient lives for 20 years without doing anything, and we are very well aware of the fact that low grade cancers may not require any treatment at all. So even
Yes.
these patients will go to them, and those people will take credit for their longevity. So number one is that misconception with the diagnosis and treatment of the cancer. Number two misconception is that people are shying away from allopathic form of treatment, which is the most scientific and most proven way, because each and everything that we do, each medicine that we have, has undergone several trials on patients, and they're not bogus trials. They are trials, millions of dollars have been spent in developing a medicine, or say suppose a robotic surgery. If you take, then millions and billions of dollars have been invested in developing a technology and its propagation. And people, surgeons especially, or physicians, or radiation therapists, or anybody involved, they've spent several years of their life in learning and training that. How can I say that a person who self proclaims to be a cancer expert, by doing some exercises, or by taking some form of food intake, or by doing some therapy of some nature, will claim to treat all these patients? So I think a proper education in the system about the cancer and its treatment is important, to avoid all these misconceptions. And eventually the patient is the one who is harmed. Nobody else is harmed, but it's the patient who is harmed, arising out of these misconceptions. the confusion that arises out of them.
Thank you, Dr. Anshuman, for your views onto that. Moving ahead with the discussion to Dr. Sandeep, can you please explain how can support groups and peer counseling be systematically integrated into the care plan for the patient undergoing the prostate cancer treatment, and what strategies can be implemented to increase patient engagement and involving in their with each other?
So I think, as I had already said in the first question that you asked, that the patient should be sensitized about the need for the peer groups. Even their caregivers should also be sensitized about the peer groups right before the start of the treatment, because patients would have anxieties, questions, forgetfulness, which they may not be able to ask during a limited session with their healthcare provider. Support groups do that too. They fill in the blank that was left and that no one else could have filled. Now, since the patients are aware about the peer groups, and the peer groups, they are best managed by the cancer survivors themselves. So as of today, the place that I worked, the breast cancer support group, the ovarian cancer support group, the prostate cancer support group, they are facilitated and managed by the survivors themselves. And by giving this support, both the receiver as well as the giver, they get some benefit. It's a common adage that whatever goes around comes around. So if you give support to someone, you also get benefits of that. Now the receiver, in the form of a new patient who is going to start on the treatment or is going through the treatment having the side effects, gets the benefit of counseling, which is done by the patient who has gone through the treatment, in which the receiver gets the proper advice, uh, and the giver also gets the psychological benefit of improved mood having helped someone. So it's a human tendency and nature. When we help someone, it also leads to release of the mood enhancing hormones in us, and that is also linked to the improved mental health, and mental health is also linked to the improved physical health. So peer support group education right from the start for the patient as well as the caregivers should be inculcated at the start of the treatment. Also the healthcare professionals, not the doctors, but the something called nurse practitioners, which are intermediate between the patients and the doctors, because one doctor may not be available all the time to answer all the queries. Some queries can be dealt at the peer group level, and the other queries which are more scientific content to it, that can be dealt by the nurse practitioners. So nurse practitioners or the specified oncology specified nurses, they also should be trained to get involved in these peer groups. Last but not the least, as I already said, technology should also be used. So patients should be sensitized and counseled to set their own goals, and that can be in a peer group. People can have closed group, or they can have some targets which are fixed, so that people who get those target fixed get the sense of achievement that we have done that, and other people of the group also try to compete and do that thing, and that is something like healthy competition, and no one is losing from that competition, everyone is gaining. So use of the technology, use of the sensitization at the start of the treatment, and involving the caregivers as the and the healthcare professionals to sensitize all the people about the existence of the peer support groups and how to best use that. That should be done right at the start. And wherever the physical presence of the patient and doctor cannot be guaranteed, use the technology to fill up that gaps. That can be in the form of WhatsApp groups, Telegram groups, or specific mobile apps which can monitor the patient. I won't say the health parameter, but the mental health parameters and the involvement in the support group. Quite interestingly, I've seen that are the females, they usually are very shy asking questions in the OPDs. Now in the gynecological cancer support group or breast cancer support group, we have seen that the patients are asking more questions, getting more better answers, and the answers that could have been much better than what they could have asked in the OPDs and got from the doctors themselves. In contrast, the prostate cancer support group doesn't elicit that type of questioning and answers that are there. So I'd say if you sensitize people rightly, involve them rightly, there is improvement in their treatment as well as the outcome. So basically, it is the sensitization, and the sensitization of the things exist.
Very rightly said, Dr. Sandeep. Thank you for these insights onto that. Moving ahead with the discussion to Dr. Nagin, according to you, like what are the most common side effects of the prostate cancer treatments, and what approach can be taken to treat them in a holistic way?
Right. The side effect of prostate cancer treatment can vary depending on the type of treatment, which will include the hormone therapy, the radiation therapy, the surgery, and other modalities of treatment. Coming to the hormone therapy, the most common side effects which we are seeing is the hot flashes, the erectile dysfunction. There is a like decreased erection, and sometimes the diarrhea, the breast tenderness. All those things are very commonly seen. Estrogen can cause, I mean, this hormone change can cause cardiovascular effects also, like heart attacks and stroke also. Radiation therapy is another modality of treatment. The side effect includes the tenderness, the sore skin, the loss of pubic hairs, the problem urinating, the diarrhea, and the back passage problem. And surgery, there is a high risk of complication from the surgery if you have previously had radiation therapy. This is always because there is a lot of fibrosis there, because of which you can have side effects. The other side effects which are commonly seen is because of the drug-related side effects, which can be managed by tapering the dose or stopping the medicines temporarily. Other side effects of prostate cancer treatment includes the infertility, the depression, and other mental health challenges, the fatigue, the constipation. There sometimes patient may complain of altered bowel habits or upset stomach, and the inflammation of the rectum also is commonly seen. So many of these side effects can be managed with medication, lifestyle changes, and dietary supplements. You should consult your doctor or care team to learn about the additional side effects which might come in future when you started or switched over the treatment modalities. The side effect of the prostate cancer treatment can be managed with a variety of approaches, including the medications like the nausea and vomiting is the most common side effect with the medication. So the anti-nausea medications like steroids, cannabinoids, benzodiazepine, other drugs can help, which can alleviate the nausea and vomiting, which can happen because of the chemotherapies which is given. And for hot flashes, your doctor may suggest you medroxyprogesterone, cephalosporin straight, venlafaxine. These are drugs which are commonly used. Lifestyle changes, the eating small portion of low fat, low fiber, and high calorie food, and staying hydrated and resting is of paramount importance. And if you smoke, you should try to stop smoking as far as possible. Complementary therapies in form of like hypnotherapies, the cognitive behavioral therapies, the herbal remedies measures. Sometimes acupuncture also to some extent can help or elevate the hot flushes also. Adjusting treatment, your doctor may adjust your doses and switch the treatment modalities depending on your need, and supportive treatment in form of like specialist who can help for your mental health being, so that I can alleviate your depression and the mental changes which can happen. So there is always an important role of a palliative care specialist. There is important role of psychotherapists or onco counselors, which are of paramount importance, and we should train our nursing practitioners who can guide us, and we should use the help of telemedicine also. And it is important to communicate with your doctor about the side effects which you are experiencing, because it may be new for you, but it will not be new for your doctor who is treating thousands of patients in a year. So early management of side effects can help you to live longer and live better.
Thank you, Dr. Nagin, for these wonderful insights onto that. Moving ahead with the discussion to Dr. Ramna. So, what are the most promising future developments or innovation are there, according to you, while we talk about the prostate cancer care?
If you're asking the future developments.
Yes.
Okay, so basically, I think the prostate cancer is, if you see the prostate cancer or any other cancer for that matter, has evolved and evolving over the time. And the last 1 or 2 decades has been quite revolutionary, I would say, for many cancers, not just prostate cancer. And whatever the development or treatment improvements that has happened, it took decades of time, right, from 1940s to 90s. It took decades of time to develop initial treatment aspects or the understanding itself. But with the advent of targeted treatment, advanced chemotherapies, newer forms of chemotherapies, or radiation techniques, or therapies like nuclear medicine based therapies, targeted treatment, immunotherapies, I think the future aspects of cancer treatment has evolved. And there are breakthrough developments in every 2 months now. So that is a breathtaking space at which cancer development treatment aspects are evolving. So the future looks very promising, and more treatment options are available. But issue becomes is the availability and access of these newer modalities of treatment to the common public as well as to the as well as to the many patients who are either in a situation where the access is not there, or affordability becomes an issue. So, but yeah, future looks very promising in terms of the development as well as the breakthrough revolutionary changes that are happening, be it technologically or otherwise.
Thank you, Dr. Ramna, for these insights. And I think it's really important to know about the future developments and other trials or maybe other treatment processes which are going to come up. So, in the end, to conclude, I would request you all to please provide us with any recommendation or maybe a message to the prostate cancer patients who actually are diagnosed newly with this disease or at the verge of this disease. So, I would request Dr. Anshuman to start first. Dr. Anshuman, we cannot hear you. Your mic is on mute.
So my message to any prostate cancer patient who has been newly diagnosed is to carefully. The first thing is the shock that comes with the diagnosis. And nowadays, what is happening is that many people in the metro cities are undergoing PSA screening. Somehow, PSA screening is no longer a part of United States health system now, but we are following it very religiously, and so newer and newer, more and more patients are being diagnosed. So this is something, this is like a circle, and every country goes through this process. So many more cases are being picked up. In that process, many patients sometimes can get treated unnecessarily also, because as I said, that you have to rationalize treatment for each cancer patient, and you have to really let go of the patients who are at very low risk for progression of the disease. And because prostate cancer treatment is a mutilating one, whether you do surgery, whether you do radiation, whenever it comes to even medical castration or surgical castration, leads to a lot of side effects in the treatment. So basically, we have to counsel the patient in great details, explain about the treatment as and when the patient gets diagnosed. So all prostate cancer, as I tell my patients, they have a spectrum of from being a cat to being a tiger. So they could be at either end of the spectrum, and really, you need not be so scared from a cat. And so treating a cat unnecessarily will lead to more side effects. So that is somewhere we have to draw a line. The clinicians have to be very compassionate, and many times in our busy practice we are not able to devote as much time to the patient education. And we should have, as practitioners dealing with cancer, we should have, as Dr. Sandeep said, that sensitization and a multidisciplinary approach wherein the clinician devotes some time, and then you have your own support team which counsels the patient about the options of treatment and how each treatment is going to work. And really, I really don't feel that we are still there when we can help our patients in a way that which is least toxic to them and most advantageous. So I think we are far away from the most ideal form of treatment for prostate cancer.
Thank you, Dr. Anshuman, for these insights. And I think this is going to be really helpful for the viewers and the seekers. Moving ahead to Dr. Sandeep Batra, I would request you to please provide us with some recommendation or the message for the prostate cancer patients.
So, as Dr. Anshuman said, that not all prostate cancers require treatment. Some are very imbecile or docile sort of thing. They will not create any problem during the lifetime of the patient. So, there is always a difference between what can be done versus what should be done. So, diagnosis of prostate cancer obviously incites an emotional reaction, and the patients or their family jump on the first wagon to get it treated without understanding that it may be on overtreatment, leading to these side effects which were really not required. So, one thing that prostate cancer at diagnosis, don't assume it is next threat to the life. Take your time to research about the things and research about the things before the start of the treatment. And this is the time when we should move on from the eminence based medicine to the evidence based medicine. So gone are the days when a single clinician will take charge of everything as far as treatment of was concerned. Now it is a teamwork that leads to the big achievements. And teamwork in the form of multidisciplinary team gives the best result. You have seen the examples. Team India going for the trophies, and a single relying on a single person would not have been possible getting the trophies. Same way in the prostate cancer, it is not the Urologists alone, surgical oncologists alone, medical oncologists, radiation oncologists, radiologists, pathologists. It has to work as a team to understand about the disease biology. Based on the disease biology and the particulars of the patient, then you have to devise a strategy which includes wait and watch to as intensive as trimodality therapy with the surgery, chemo, radiation, hormone therapy, everything. So do your research before the start of treatment. Don't run around the names. Run for the team that cares, and possibly at a center which is close to your home, because you may require repeated visits, and a center which treats the cancers day in and day out, not like a person who does a surgery in about 6 months or 12 months and saying that I'm a prostate cancer expert, as Dr. Anshuman rightly pointed out. So don't be afraid of the disease. Open up. Take your life reins in your hands by understanding about the disease, and make the informed decision, so that tomorrow you not do not blame anyone that they misguided you. You have the right to your life. You have to understand your disease. These things happens. These may be called as the fault in our stars. Incidentally, 1 in every 7 males will get prostate cancer in their lifetime. Whether it is going to be symptomatic or not, that's a big discussion that can be reserved for the later things. But patients need to be made aware. Even if they are not educated, they are old enough to understand about the intricacies of the treatment. And if they get involved themselves in the treatment, their families get involved themselves into their treatment, then the outcome is definitely going to be much better than uninformed treatment decisions which were taken in a haste and not with the proper consent. So my one line would be that patients, they should be taking charge of the treatment, and no one else should be allowed to take charge of the treatment.
Thank you for these wonderful insights, Dr. Batra. Moving ahead to Dr. Nagender, what message you want to deliver to the patient who are newly diagnosed with the prostate cancer?
Right. As I do agree with my co-panelists, what they are told, most important thing is that get informed. First of all, right information is the right of the patient. If they are aware about their disease, or they are aware about the side effect of the treatment, they are aware about that it is not a one-person job. No single doctor can treat prostate cancer alone. You require a multidisciplinary tumor board approach in which you require a medical oncologist, the radiation oncologist, the surgical oncologist, the psycho-oncologist. There is the important role of the diagnostics pathologist. All those things are required, because of which we can manage the patient. Second thing is, wherever possible, get the support. Make use of the psycho-oncologist. The cancer care groups are there. The telemedicine, we are living in a digital era. Most important thing is that always discuss with your treating doctor. Make sure that you communicate your side effects which you are facing through. Make sure that you involve them. Keep a good record, like what happened. Like so many times, the prostate cancer treatment is in years, right? It's not in months, or it's not a little disease. To my understanding, over a period of time, patient have to live with the disease, and they have to live with the treatment. Initially, the patient will be having a localized disease. Over a period of time, it will go to locally advanced and then advanced disease. So make sure that you should have to reduce the stress, because the treatment is of longer duration. You have to have a positive and optimistic attitude. We have to understand that science is not static; it is dynamic. It is changing and evolving rapidly. So there are so many treatment modalities which are available, which is for the patient's betterment. And we have to make sure that at correct time we have to make sure that patients should get the latest modality of treatment approach. Other thing is, wherever possible, try to have a good discussion with your treating doctor. Make sure that they are always keep informed. Not only if the doctor is not aware, the team doctors will be there, in which you have to bring it to their notice. And if at all anything is to be done, it can be done in time. So time, the priority is very important. In these days, remember that getting a correct patient under correct doctor treatment at correct time also is very important. So if that is there, then only you will get the correct and best treatment for that matter. So ultimately, remember that if you want to walk fast, walk alone. But if you want to walk far, walk together.
Thank you for these insights, Dr. Nagin, and I think these are really helpful for the seekers out there. Moving ahead to Dr. Ramana, in conclusion, what message do you want to deliver to the patients who are newly diagnosed with the prostate cancer?
I think I said you in the opening statement that prostate cancer is a chronic disease now. It's like it's like a diabetes or a other thyroid problem or something like a CKD, something like that. So, but the diagnosis of malignancy, that itself causes a lot of shock to the patient as well as to the family. So I think key thing is to making them understand that it's a long-term disease. Educate them regarding the long-term treatment plans and the treatment effects and the close follow-ups that are required. and the logistic support that are required. So I think it's mostly about the family as well as the patient education, which revolves a lot of treatment aspects. And also, sometimes these days you have so much of social media, or for that matter internet. There's a lot of information around. But sometimes having more information rather leads to confusions than having a conclusions. So I think you need to make certain conclusions out of the information that one would get. So giving the right information and also taking them to a logical conclusion is what makes the overall treatment successful. So I think key thing is to educate the patient, and the arrange the logistics or the the support care groups, involve the other team doctors, including a palliative physician, psychotherapist, right from the beginning of diagnosis. So I think that would give us a holistic approach and a focused treatment as well to the prostate cancer.
Thank you,
Yeah.
Dr. Ramana, for these insights, and I think it's really wonderful. In conclusion, our objective for today's panel discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our esteemed panelists have addressed this topic very comprehensively and effectively, presenting the information in a manner that is both thorough and accessible. I would like to extend my sincere gratitude to each of our panelists for their insightful contribution and sharing their expertise with us today. Your participation has been very valuable, and we deeply appreciate the time and knowledge that you have shared. I would like to thank all the panelists who have joining us today and all the viewers who joined us. Thank you so much.
Thank
Thank
you.
you.
Thank you.
Good day.
All right. Thank you.
Thank you. Good night.